Hi everyone, Ollie here and welcome back to another end of the week wrap-up diary video thing. I still haven't worked out what it is I'm calling these. It's 20 past 12, so 20 minutes into Monday the 11th of December. I'm really tired and I want to go to bed. So as I always try to, I'm going to keep this as brief as possible. So Monday was all about hypersensitivity and shock, kind of related to the cardiac respiratory stuff that we've been doing. So it was having a look at anaphylaxis and the kind of things you can do when someone goes into shock reactions. That was a nice change, I think, and it's different to a lot of the material that we've had so far. It did seem to be, to me, just a lot of rote learning for kind of signs and symptoms, but still, it's a change from looking at mechanics of breathing and flow through tubes. I remember on Monday we actually had a session on candour and truth-telling. Now that one was really interesting because obviously I think most people's gut reaction would be obviously you would always want your doctor to tell the truth, and whether there is an ethical demand for them to do that and how it might vary in situations that are a bit more complicated, like how much of the truth are you obliged to divulge, or if you feel that divulging the truth would actually result in a negative outcome for your patient and maybe a lower quality of life as a result of your disclosure, is that the correct thing to do? And thankfully, unlike a lot of the SOCPOP or VLE things that you have to think around a little bit, the answer just seems to be always tell the truth, which is a nice little rule of thumb to work by, I think. And I think mainly, like from my perspective, the view that I have on it is that an individual doctor is not a kind of arbitrator of moral value. I don't think that I would be the correct person to make that judgment, or certainly I'd feel a bit uncomfortable, I think, if my doctor, when treating me, decided to purposefully withhold information from me that I might want to know, even if they thought the outcome might be better, because they don't know what my personal perspective is. I had a really nice conversation during my break on Monday with my friend Jess, who's currently, or she was, on her way to Brazil to carry on her year abroad. She's studying languages at uni, super smart, she'll do really, really well. Jess, good luck, we're all missing you. The other thing that was quite exciting on Monday, so we had the second session of our CBL case. We're into the final week of the block now, obviously, and instead of actually addressing the case in any way, we had all set ourselves quite a lot of homework to do in terms of presentations to prepare on various topics. Things like clotting was one, relevant pharmacology was another. My job was to make sure everyone else in the room understood ECGs, kind of how to interpret them at a very basic level and fundamentally the science underpinning them. The thing that I struggled with electrocardiograms was understanding the principles on which they're based. But once I had that down, the rest of it came really, really easily, and I would recommend for anyone wanting to learn about ECGs, the guides on Life in the Fast Lane. It's a website, I think based at Emergency Medicine, I can't quite remember, but that was how I came to understand it, and I based a lot of my presentation on their work. And at the end of the session, so if you remember last week, I did an optional ECG lab on the Wednesday, and one of the tutors there, one of the demonstrators, mentioned that she had a kind of small portable ECG kit available in her office, so I asked if I could use it to use in demonstrating for my ECG session, and she let us use it, and it was really good. We took a couple of readings from people, and thankfully their hearts were normal, so that was a good thing. The other thing as well on Monday, it was so disgusting. Basically, I found that meal prepping offsets a lot of the cost of med school. The canteen here is quite expensive, so preparing meals either on the morning or basically taking a packed lunch just saves a ton of money. And so I take them in a Tupperware container usually. What I found, so I'd it must be 5-6 weeks ago, I'd prepared a tuna pasta salad for lunch, quite a healthy ish thing to take to lunch with you. I then clearly put it to one side, and by one side I mean in my wardrobe for some bizarre reason, and then clearly put something on top of it. So Monday morning I actually found this discarded box, still sealed and airtight, but with like a 6-week-old fish pasta salad in it. The smell was absolutely unholy. I opened it in the kitchen on the first floor, and the whole first floor you could smell like rotting fish. It was absolutely disgusting. Tuesday, not an awful lot happened. I basically spent it making Anki cards specific for our OSCE prep. By this point, I'd sort of assumed that the formative exam was going to go badly and that I wasn't going to pass it. So I thought, well, given that I'm going to fail this, I might as well just put more time into prepping for the OSCE. So this was looking at things like, why would a patient have leukonychia or something, or koilonychia to do with your nails? Why would I get that observation? What does that mean in terms of the patient's illness? And basically putting all of these questions into Anki cards to revise from, which I found really useful. So on Tuesday as well, I actually got a splinter in my foot. What I assumed it was, and more on this later, was that the locks were changed on all of our doors in the house recently, and they had to have a carpenter come out and kind of widen the indent into the door where the lock goes, because the new bore was a lot bigger. So there was a load of like wood trimmings and bits all over my floor that they decided not to clean up for whatever reason. And I stepped barefoot out of bed, felt something stick into my foot, and just kind of lodged there. I didn't take it out at the time, which was a bad idea. And by the time I got home, it had sort of, my skin had started to heal over it, and it was getting quite painful to go near, so I just left it. Wednesday was a really, really nice day. So we had brunch with our CBL group at Zanana's. I'm still not sure whether I'm saying that right or not, but it's a little kind of restaurant on main campus. So this was our sort of CBL group Christmas dinner. We all turned up in our Christmas jumpers, and it was really, really nice. From there, we then headed on to conclude the last CBL case of the blocks. This was on Wednesday morning, and we had Secret Santa. And it was one of the kind of most fun Secret Santas I've seen in a while. We were all just like big kids. Bear in mind, everyone is at least 21. So what we did, we all had Secret Santa presents for each other. For those that don't know, Secret Santa, basically everyone puts their names into a hat, so everyone in the room. Then you pull out a name and you have to get a present for them in secret, and then everyone comes back together and gives out their presents. So we made our facilitator go and stand outside the room, and then went one by one, giving her all of our presents to put into a bag so no one could see who was putting which present in. Then we all came back in and gave them out. There were some really, really cool presents given out by the group. I think people had tailored them really quite well. There were things like suturing kits. There was a head mounted like basketball game, things like that. And my gift, which I think is absolutely amazing, was this lovely kind of beer mug, I think you'd call it, which I don't know whether you can see very well, but it says eat, sleep, vlog, repeat on it. So really nice kind of personal gift. It was really, really cool. Thank you, Emma. I love it, and I'm going to use it very heartily over the holidays, I would imagine. And we did actually obviously have to catch up and finish the case properly. We got the diagnosis. The patient had bilateral heart failure. And the way we basically got to that diagnosis was that if you imagine the heart has two sides, obviously, if the heart stops working in such a way that it's not able to pump blood out of one side quickly enough, then as you would expect, blood kind of backs up behind that side in the system. So remember that the left side of the heart supplies systemic circulation, the right side of the heart goes to the lungs. So if you have a right-sided heart failure, fluid starts to build up in the lungs and you get pulmonary edema. Whereas if you have left-sided heart failure, which is much more common and most cases seems to lead to right-sided heart failure, you get back up in the systemic circulation, so you get fluid build-up in the legs or in the sacrum if the patient's lied down. And actually on Wednesday evening I had a development with the splinter as well. So what I did was I got a jeweler's screwdriver because it was starting to get quite painful, and I thought, right, I'm just going to hack the end of my toe open and get this thing out. It turned out to be a little bit of glass, so it was probably a good thing that I did get it out. And before I get ripped apart by the internet community, I did alcohol sterilise my jeweler's screwdriver first, so I did it properly. So on Thursday we had our Block 2 roundup. This only took from the morning into the early afternoon, about 1 o'clock. So basically the premise is that you go for sort of, I think there were 45-minute stations that might be looking at one particular area. So you might have like heart anatomy, cardiovascular pharmacology, things like that, and you'd rotate around all these stations. I don't like this format very much, and I've been quite vocal about this, as my course mates will know. My logic being that if you don't know the material, because basically the format of the roundup is just a load of questions that you have to answer, you can talk through them with other people, but you're basically given a worksheet with a load of questions on it. And so my logic is that if you don't know the answers, you'd be better off revising that material like from the lectures on your own. And if you do know the material, then you don't need to be there because you already know it and you could be revising something else. I think it's just another one of those cases where it feels inefficient to me, but they are compulsory sign-in sessions, so we have to go. In the evening, I did my formative exam. So if you remember, I just scraped through in block 1, I just passed. And block 2, as I've kind of hinted before, I was very, very much not confident about. Thought I was going to fail it. And there's nothing wrong with failing them at this stage, by the way. You're not obliged to pass the formatives. What I'm really happy to be able to say is that I did scrape a pass. So it's split into multiple choice questions and short answer questions. I did a lot better on the short answer questions. I think I got like 78% or something like that. Because there was one on cardiac anatomy, which has been one of my favourite things from the course so far. And there was an ethics question as well, which I also quite enjoyed and managed to do quite well. The multiple choice questions were really hard, and I think I got 64% or something like that, and I guessed quite a lot of them. You need 60% in both sections to pass the exam, or the formative, but I just scraped through, so I'm really, really happy about that. I think I don't know what it's been about this block, but I think there's been a lot more abstract concepts to understand, things like laminar flow through tubes and the physics of gas exchange and things like that, not things that you jump to when you think about like human biology and medicine, but they are really important to understand. And we actually went out that night for dinner at an Italian place called La Bellagio in Leamington to celebrate having finished the formative, which was really, really nice. So day 5, teaching had essentially finished at this point, so we went in, had anatomy first thing, which I expected to not really know anything about, particularly the stuff from the beginning of the block, because like right now I'm quite hot on cardiac anatomy. Like I really like it and understand it. I thought I'd forgotten everything I knew about the lungs, but thankfully I did remember most of it, and the paranasal sinuses and the structure of the nasopharynx, things like that, which I also really enjoyed. So managed to do quite well in that session. And there were some dissected tissue specimens as well, which had apparently come from a surgical training course run a couple of days before. So there was a heart, there were some lungs, and a heart attached to some lungs. And the real thing that I noticed in the lungs, if you kind of squeeze lung lobes between your fingers, obviously while wearing gloves, you can feel the alveoli collapsing. It feels like tiny little bubble wrap, almost like you can feel it almost fizzing under your hand as all the tiny little sections close off. It's very bizarre. We had radiology as well after that. There was no seminar, but we had radiology immediately after anatomy. We were doing heart echoes, so essentially like an ultrasound exam. I got my heart looked at, and it was really interesting. There were only 3 people examined, so he did abdomen and kind of upper and a bit of lower abdomen as well. But even between the 3 people that we saw, which was 2 males and 1 female, there was quite a bit of anatomic or anatomical, I don't know, variability. So like the guy doing it sort of expressed a bit of surprise when he saw certain things, and that was really interesting. We spent the afternoon going through all the exams that we need to know for the OSCEs, and this was a really good chance just to ask any questions or get anything clarified that we didn't understand. just because of the way that some of the teaching has been handled this block, I don't think, personally speaking, some of the clinical teaching that I've had and that my group has had has been the highest standard out there. It's meant that I hadn't seen a lot of the correct techniques for certain things. So actually mixing up between the different demonstrators, I was able to ask and get a lot of things clarified, so that was really good. And after hospital, we came home briefly, had something to eat, then I went back to uni. It was absolutely freezing cold. For some reason, the first bus that showed up went past me, didn't stop, no idea why. The public transport around here is very bizarre. Went back to uni to the Games Soc, which I am a member. I really love it when I can go to it. Normally I'm really tired on a Friday, but we actually got some of the older students, so second and third years, to help us practice our OSCEs. So I got to practice my history taking, acted as a model, some people doing their physical exams, and it was a really, really good learning opportunity to learn from older students who've been through the first year OSCEs, rather than just demonstrators, because you get a few more sort of secretive hints and tips that, while a demonstrator might not tell you them, they are actually really useful practical things to know. Yesterday morning, so Saturday morning, we went down to the uni sports centre to support my housemate Emily. She was playing korfball with the Warwick team against the Birmingham team. It was really interesting. I've never really heard anything about korfball before. As far as I can work out, it seems to be a sort of mix between netball and basketball. But it has an interesting factor. I keep using the word interesting, I apologise, where you need 4 males and 4 females on your team. Players can't shoot for the basket, which is taller than in basketball, and there's no backboard. It's like a loop horizontally to the ground. I think it's 3.5 meters, which is actually, it looks quite difficult to score a goal. Players can't shoot for the goal while they're being blocked, like by another player, while they're marked, and the other player has their arm up over them. But only players of the same sex can block one another, which I thought was very cool, because that kind of makes it more about movement and tactics rather than sort of like sheer physical bulk. So the Warwick team played really well, and actually I've decided that after Christmas I'm going to go to a training session or two. I think it looks, I mean, I played a bit of basketball in school and really enjoyed it, and this looks like it could be really fun. Apparently it's very laid back, because the Warwick team is so new, so no one's like adept at it yet. So I think it's still a good time to get involved. And that evening, I actually, I'm a massive nerd, for those of you who don't know. I do enjoy playing video games, and that's been really, really difficult to justify to myself. I just noticed my monitors have gone off behind me. Because with the workload we've had here at med school, it's always been like, should I be doing this? Shouldn't I be revising? But I actually sunk an hour into a game called Epistory Typing Chronicles, which is like a speed typing game where you have to type out words to make things happen in your character's environment. It's really pretty, and I recommend it if you get it on sale. Which brings us to today. I mean, it's Monday now, but I'm talking about Sunday. And it's been snowing like mad. It's absolutely white over. I'll intersperse some video footage like I normally do, but I needed to go to the post office, so me and Emily went all the way to the other end of town, which is like it was more like a half-hour walk in the snow. It's absolutely covered, and we like diverted around various things to go through the parks and things like that, and see there were snowmen absolutely everywhere. Kids kind of being pulled around on sledges and throwing snowballs. There was a guy flying a drone in Jefferson Gardens. I'm not sure quite why. It was still snowing. I don't know what he would have seen, but it was absolutely beautiful. Walked all the way down to the post office, which for some reason wasn't open at all, despite us being in the correct time when it said it should go and visit. So I need to go and get my parcel tomorrow, which I suspect is actually a late gift for our CBL facilitator. We got her some Harry Potter socks, which she really seemed to enjoy. We have actually got another gift, but it didn't arrive on time. There was a delay with the shipping, so I'm hoping that's what it is, so we can take it to her next week before we disappear for the holidays. We spent the afternoon, the three of us in the house, practicing our OSCE exams on one another, practicing general histories, and it's really good just to do. I think it would be much more difficult if I wasn't living with other medics, but it's really good because you can be honest and kind of harsh markers, so you really drill into yourself what it is you need to do. Then we broke up, had some dinner. I've Skyped with my dad tonight, which is really good just to catch up with him, so I'm going home next weekend. And we've played Cards Against Humanity with one another this evening, and I think one thing to note about med students, and this is true of doctors, they have the sickest and most twisted senses of humour in the world. Which is probably a good place to wrap up this video, because I've ranted on, as I normally do, far too long. Thanks very much for watching, guys. Please be sure to hit that like button for me, leave a comment if you've enjoyed the video, subscribe to the channel if you'd like to see more, and I ask you please go and check out my website, PostGradMedic.com. You can read my blog from every single day. There's a load of interview prep and UK CAT resources on there, and I'm going to be adding a lot to it. Over Christmas, I'm going to start teaching you some medicine and doing some anatomy and kind of pharmacology presentations, because I need to revise, and I think producing resources is a great way to do that. So take care, guys, and I will see you next week. Bye bye.